Welcome to the 2020 Vermont Statewide EMS Protocol Update, Exertional Heat Stroke, EHS, and Hyperthermia. We have added a new Exertional Heat Stroke, EHS protocol. This protocol is designed to be used together with the Environmental Hyperthermia protocol and applies in the special situation where cooling via a cold water bath is available on site. This may be at a sporting event such as a marathon, a training event, or an MCI. If cold water bath is not available, the same principles apply, but also see the hyperthermia environmental protocol. Exertional heat stroke is a unique and emergent hyperthermic condition that occurs in individuals performing intense physical activity, typically not limited to only warm environments. Consider EHS in any intensely exercising athlete, laborer, fire, police, or EMS personnel with altered mental status. Rapid cooling on site in a cold water bath rather than rapid transport has been found to be the best intervention to save lives. Let's now review the full protocol. The exertional heat stroke protocol runs as follows. Perform a rapid assessment. Look for other potential causes of altered mental status. Consider EHS in any intensely exercising athlete, laborer, fire, police, or EMS personnel with altered mental status. If EHS has been confirmed and appropriate cooling has been initiated by an appropriate on-site medical team, do not interrupt cooling for assessment or transport. If care has not been initiated and EHS is suspected, immediately perform a rectal temperature. If Trec is at or above 40 degrees Celsius, 104 Fahrenheit, initiate immediate rapid cooling to a temperature less than 40 degrees Celsius within 30 minutes of collapse. The best practice for cooling an EHS patient is whole body cold water immersion from the neck down. Immersion in ice water filled body bag, tarp, or fire department portable tank may also work. Ice packs, fans, cold water dousing, or shower do not achieve acceptable cooling rates. Rotating ice water towels covering as much of the body surface as possible should be considered a minimum cooling modality en route. Discontinue cooling at 39 degrees Celsius or 102 degrees Fahrenheit. If a rectal temperature is not available, cooling should not be interrupted or delayed in cases of suspected EHS. Cool for a minimum of 20 minutes or clinical improvement if resources are available on scene, or transport with best available active cooling method, body bag with ice water or rotating ice water soaked towels. Do not interrupt cooling for diarrhea, emesis, combativeness, or seizures. IV/IM medications are rarely needed. Transport to closest receiving facility and notify that EHS is suspected. For events with medical personnel and cooling means on site, the only appropriate standard is to cool the EHS patient in place in a cold water bath. Transportation of an EHS patient should only be done if it is impossible to adequately cool the patient or after adequate cooling has been verified by a rectal temperature. The only accurate or acceptable body temperature measurement in exercising individuals is a rectal temperature. EMS must ensure early pre-notification to hospitals if they will be receiving an inadequately cooled EHS patient or suspect EHS in a scenario where treatment has not been initiated. Hyperthermia environmental. Consider the EHS protocol with rapid cooling by immersion for the intensely exercising athlete, laborer, fire, police, or EMS personnel with altered mental status due to exertional heat stroke. For classic non-exertional heat stroke, especially in the elderly or patients with multiple medical problems, continue with this hyperthermia protocol. If temperature is greater than or equal to 40 degrees Celsius or 104 Fahrenheit, or if altered mental status is present, begin active cooling by whole body cold water immersion from the neck down. However, note, elderly patients are less able to withstand sudden shocks, so begin with less aggressive cooling measures like misting or cool wet cloths. When you reassess the patient, if there is little or no improvement, use more aggressive measures. For the elderly patient or patient with multiple medical conditions with non-exertional hyperthermia, consider continually misting the exposed skin with tepid water while fanning the patient, or rotating ice water towels covering as much of the body surface area as possible. ALS may consider giving a chilled IV fluid bolus, and paramedics may consider sedation to avoid shivering. Note for paramedics: benzodiazepine doses for stopping shivering are lower than those for stopping seizures by approximately half. This concludes the training module on the 2020 Vermont statewide EMS protocol update, exertional heat stroke and hyperthermia.